This year, November 14th, is recognized and celebrated as World Diabetes Day. And the two major organizations, the IDF, International Diabetes Federation, and WHO, they come up with a theme every year in terms of increasing the public awareness and helping the diabetes patients in their journey throughout their lives. This year we have two themes, that is diabetes across all stages and diabetes and well-being. I have with my dear colleague Dr. Pallavi Patri, the senior nephrologist, to talk about the implications of diabetic kidney disease and how to go about it. Hi Pallavi, thanks for coming.
Hi Radhika.
We understand that diabetes incidence and prevalence is increasing, right? So how common is it in India, and what is the burden of the disease in India?
So, diabetes, India is slated to be the world leader in the number of diabetic patients that we have. So we're going to be the top country for incidence of diabetes. And of the many organ systems that can be affected by diabetes, kidney disease is actually a very concerning, form of manifestation of diabetic damage. And to the extent to which the most common cause of end-stage kidney disease, where a patient requires kidney replacement therapy, like either dialysis or transplant, the most common cause of that condition is diabetes. There are type 1 diabetics, there are type 2 diabetics. Most adult patients have type 2 diabetes, right? Type 1 diabetes, the prevalence of kidney disease is very high. Those are younger patients. But in type 2 diabetes as well, up to 30, the studies show that globally anywhere from 30 to 40% of patients who have diabetes will develop kidney disease in their lifetime. And a percentage of those, up to half of those, will progress to end-stage kidney disease, where they require kidney replacement therapy. So it is a very serious concern.
That's quite scary, right?
Yeah.
What are the symptoms and signs? So how can they recognize? Because majority of the time the patients are once they reach it, they are worried about it, but they are kind of unaware how to prevent it earlier, right? So what are the signs and symptoms when it really happens, or anything to recognize a bit earlier as well?
Yes, so that's actually a very important question, because kidney disease in general, whether it's diabetic kidney disease or for kidney disease from any other condition, it tends to be quite silent in the early stages. So many patients will have no idea that they have some dysfunction with their kidney function. And really the best thing therefore to do is, as you go see your endocrinologist, on a regular follow-up, even in the early stages of kidney disease, diabetes, you should have screening done. Just as we screen, you send patients to have their eyes screened when you have diabetes.
That's right.
You should also be having your kidneys screened.
That's
It's a basic test that can be done, because you will not have symptoms early on. In the later stages, where the kidneys are really affected, more seriously affected by the diabetes, then patients may start having swelling in their legs, because protein losses, that's what we typically see, protein losses in the urine lead to swelling in the legs. And in more severe stages, they will start potentially even having shortness of breath, itchy skin, fatigue. Did they develop other issues like low blood count, electrolyte problems? So a lot of problems can develop, but most of those problems, and symptoms-wise, you don't really have very many symptoms until later stages
That's the
problem.
That's the big problem, right?
Yeah.
So that's why many of our patients feel that I don't feel anything. Why do I really worry and care about it? And I do come across patients just checking their fasting sugar or just a postprandial, just a couple of readings. They are not aware that there are many aspects too in terms of blood checks, with particularly about diabetes, right? So doing this kidney parameters, doing a simple routine test, urine test, all these things, they are not aware of it, where they can recognize it earlier, much earlier, rather than getting into that end-stage kidney disease.
Yes.
That's good. And what the patient can do anything about it, in terms of getting into that stage, apart from doing investigations, and what else they can do by themselves as a patient and the family?
Yes. So other than the investigations, and just to recap, in terms of investigations, there's some very basic tests, as we
that's
said.
very important.
A blood creatinine level, and electrolytes. Very often the electrolytes are a little bit abnormal, especially potassium levels, for example, with patients who have diabetic kidney disease. And a urine test, because as I said, usually the very first sign that a doctor at least can pick up on in terms of effect on the kidneys from diabetes, the blood creatinine level that tells us the function of the kidneys may be completely normal. But you might have what is called microalbumin spillage in the urine, so trace amounts of protein beginning to spill in the urine. And even if you catch things at that early stage, you can change the course of the disease. So what can a patient do? There are things that the doctor can do for you, and we'll speak about that. But what can a patient do? So the follow-ups are important. Early detection is of any kidney associated issues is really important. But of course, the basics, right? Really good sugar control.
Yeah, that's right.
Right? Your diet, exercise, following up with your doctor, having your medications adjusted when they need to be. Acceptance of the issue is a big deal. Along with that, managing all the other potential, factors that can affect your kidney function. Blood pressure control. Very important. So blood sugar, blood pressure, and also avoidance of toxins, right?
Yes.
So
that's very common in our country, right? Looking for alternative type of treatments, right?
Absolutely. So alternate treatments, Ayurvedic medications can be dangerous to your organ systems, including the kidneys.
Unsolicited ones, right?
But even basic drugs, right? So you guys, aches and pains, absolutely, aches and pains here and there with standard painkillers known as non-steroidal anti-inflammatory drugs, very bad for the kidneys, and especially with chronic use, or sometimes even a few doses can be problematic for a diabetic patient with kidney issues, right? Chronic use of gastritis medications.
That's very common in our setting, right?
Absolutely.
It's just taken as a candy pill, people believe that is not going to harm them. Isn't it? It's available easily as over-the-counter pill. Yeah, true.
So Pan, Omez, these are simple basic drugs that we think are harmless, but if we constantly take them, they can affect the kidney function. And there's several antibiotics, several things. So basically the point is, screening number one is important. Once you've been screened and you're thought to be at risk, or even if you're not, be careful, you need to go into protection mode. Okay, so as a patient, make sure you get on top of diet, exercise, control of pressure, control of sugar, avoid the bad things, as we've discussed. Watch your weight. Obesity, being overweight in itself is a risk factor aside from the diabetes.
That's right. That's
becoming
a big problem, right, in our country now. We are competing with the Western counterparts now in terms of BMI. Yeah, true. Good. Of course, one thing I have to say, we share a lot of patients between us, right? And so in terms of managing them, patients, once they reach the kidney status, that level, kidney failure, they are very, very sincere with you. But when it comes to before that stage, they are not as sincere, in terms of controlling their sugars, because it can go unrecognized and goes asymptomatic, they don't feel the symptoms. That's the problem we face in our settings, because majority of the care is spending money from their pocket. It is a financial burden for them. It just as you rightly said, in terms of screening, go for the regular checkups so that you don't get into that stage. That's very, very important. As you say, for the nephrology perspective and also from cardiology perspective, where that is a killer at the end, isn't it? That's very, very important. Then coming to our final question, as a nephrologist, what do you do in terms of taking care of these patients? So there are many things that we can do. We have a few tools in our kit to help at least slow the progression once a patient gets to the point of chronic kidney disease, or even earlier. Of course, the earlier we get the patient and the earlier we get to interact with the patient, the more we can do to protect the kidneys, to delay the progression or delay their entry even into a stage of kidney disease, right? But once a patient has been diagnosed with diabetic kidney disease, there
there are medications that we can use to slow. The problem with chronic kidney disease is once you've entered a chronic kidney disease stage, right, especially when there's a lot of protein losses in the urine, the condition tends to progress. So early detection, early management is really, really important. I can't stress that enough. There are many medications. There are some very well-proven medications. As we know, the medications such as ACE inhibitors or ARBs, that's a class of drugs that has been well established to show that they decrease protein losses in the urine. They can sustain kidney function for a long time. But recently, in the last several years, we have several more medications that have been added that actually really do show that kidney disease can slow down. Many drugs that there are diabetic medications that we use actually even to help with the kidneys now.
That's right.
And there's several medications. So we look at every medication that we use. There are risks and of course, but there are benefits and of course side effects of the medication.
That's where a specialist intervention is needed in terms of balancing it out, right? That's where the follow-up is also absolutely necessary, like not just to keep on taking inadvertently, right? So
and that's where and basically what I think is really important is that the endocrinologist and the nephrologist work together. There is almost with all the patients that Dr. Radhika and I share, there are multiple phone calls that go back and forth.
True.
So that we work in conjunction, because a multidisciplinary approach to patient care really helps that patient stay as far away from the really bad kind of complications that we can have with these conditions.
So apart from these medications, what are the other, when they have reached the end stage kidney disease, and what other hope and options are there for our patients?
So the wonderful thing actually in a way about kidney disease is that there is always hope. So in the absolute end stage of kidney disease, where we have to have kidney replacement therapy, there are several options. There's dialysis, of course. Dialysis is, for a patient who has no other options. Older patients who have multiple medical issues, that may be their only option. But there are two types of dialysis options. There's a home version, peritoneal dialysis, and there's hemodialysis. So you can still have a meaningful quality of life if dialysis is the only option. The much better option for those patients who are appropriate medical candidates, is transplant. Kidney transplant is a massive game changer for any patient who reaches an end-stage kidney condition, because their lifespan improves dramatically, after kidney transplant as compared to with just dialysis. They live much healthier lives. So everything, quality of life, lifespan improves dramatically after transplant.
Who's your youngest renal transplant, kidney transplant patient, and oldest renal transplant patient? What is their age group you have handled with?
So I'm an adult nephrologist, but we have pediatric nephrologists in our team. So you can transplant as a child. So as an example, I have one patient who got his first kidney transplant at the age of 8. Failed that transplant and then I met him at the age of 32. So he kept his kidney until that point. He took it easy with the medications, and unfortunately then ended up losing that kidney. We've given him a second transplant. So these things are all possible. And like I said, a lot of people come to me saying, well, I'm diabetic, I have heart disease, I'm diabetic, I don't think I can I'm not healthy enough for a kidney transplant. That's not true, because as we discussed in the very beginning, the vast majority of patients who reach end-stage kidney disease are diabetic, because it is the most common cause of kidney disease. So a lot of patients that we end up transplanting are diabetic. And they can do really well. We have to manage the diabetes really well. Diabetes can always affect their next kidney depending on how young they are when they get that kidney. It can affect the kidney function if depending on the age that they get that kidney. But the point is, if you manage the conditions well, you can give that patient substantial longevity.
New life,
and a brand new lease on life.
Exactly, that's right. And the other question, I should have asked it earlier, patients do fear about in terms of taking the necessary anti-diabetic medications, including insulin. They fear like, by taking these medicines, my kidneys can get screwed. Is that true? As a nephrologist, do you think so? Like, how to demystify this belief in the patient's mind? Like, they often think that way.
So that definitely is something that you have to dispel as a myth. There, in fact, actually, the vast majority of diabetic medications actually don't hurt the kidneys.
Yes.
They really don't hurt the kidneys.
Yeah.
You may need your diabetic regimen adjusted as your kidneys continue to fail.
Yeah.
If you have chronic kidney disease, and as the condition progresses, yes, to avoid other side effects of drugs,
yes,
you may have to adjust your diabetic regimen.
Yeah.
But the medications in themselves don't really damage the kidneys.
Yeah, that's very important message. True, absolutely. Yeah.
And I would say in conjunction with that, of course, every medication has, like I said earlier, benefit, side effect, benefit, side effect. Some diabetic patients with kidney disease do better on a certain set of medications, some do better on another set of medications. Again, this requires conversation between the endocrinologist and the nephrologist. And the most important thing is the fear of the medication should be secondary to the fear that you have of what happens if the kidney disease progresses.
Absolutely.
And the diabetes is not controlled. The diabetes has to be controlled in order to give your kidneys the best chance.
You make my job very important, Dr. Pallavi.
Well, you help me out so much, so yes, it's a very good team effort.
That's good. Great. Yeah. Thank you. Thank you very much.
Thank you.